We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have Mike on the line from Tribeca. Good evening, Mike.
Hi, Dr. Lederman.
How are you tonight?
Good. How are you? Enjoying your show?
Thanks.
See, I was wondering, since
I'm just going to tell someone else who called me simultaneously. Just hold on a minute. We'll take your call after Mike. So go ahead, Mike.
So I was wondering, the fact that your techniques seem to be about 90% or
just
better.
Hold on, ma'am. Yeah, go ahead. Sorry.
In effectiveness, and other techniques seem 50, 60, or even less than that. Doesn't that raise ethical questions with the other techniques? And why aren't other people using your technique?
Okay, I got your question. I just got to speak to this woman. Gail, you got to hold on. There's another caller, so just be patient, okay? Thank you. Okay, so the question is are what other doctors doing unethical? Well, let's look at it this way. Let's just say, for example, there's a brain surgeon who specializes in removing acoustic neuromas, and he spent 30 years of his life perfecting that surgery. And then I come up with radiosurgery, and all of a sudden, instead of the patient being deaf, which 90% of the people who have surgery are deaf, with us, 98% of people hear. And with him, 50% of the people have facial paralysis. With me, it's almost never seen. With him, they have to open up your head and cut in your brain. With me, it's totally non-invasive. So you can see that the treatments are diametrically opposite. Invasive with them, non-invasive with us, well-tolerated with us, poorly tolerated with him. Now, is he just going to quit, retire, and go to Florida, or is he going to keep on doing what he's doing? And I can tell you, sadly, unfortunately, most of these guys keep on doing what they keep on doing. And it is sad. Look at the same thing with prostate cancer. So with prostate cancer, if you look at the data, most men who have radical prostatectomy, which is the surgical treatment for prostate cancer, most men will have loss of their sexual function to some degree or totally, loss of urinary control to some degree, and the success rate is much less. For example, Gleason 7, if you have Gleason 7 cancer and you go to the most famous surgeon in America, his success rate's 65%. Our success rate's 90%. So is that guy going to give up 30 years of his experience just because I'm so much better than him? And the answer is probably not. He's probably going to keep on doing what he's always been doing.
Well, shouldn't some medical ethics board make some ruling that, well, this treatment is outmoded and you can't do that anymore?
Well, as I say, everyone is the president of the United States of their body, and each person gets to decide, and you have smart people who choose probably what I would consider not the best decision. You had Secretary of State Kerry, who had radical prostatectomy for his prostate cancer, even with all those bad things I told you about. He's a smart guy. He went to his hospital, a big hospital in Boston, where he was senator at the time, before he ran for president, and had his prostate removed. So, you know, in my life, I just see you can't tell everybody what to do. I remember when I was a little boy, I thought you could make the world better and everyone would follow you. And my dad told me when I was a little boy, he said, you know, when you're young, you try to change the world, and then you realize you can't do that. You try to change the country, and you can't do that. You try to change your state, and can't do that, and the city, and the family, and the neighbor. And finally, you're down to yourself. And ultimately, as a doctor, I'm trying to help each patient the best that I can. And still, the patients are going to get all this conflicting advice, and they've got to decide who to choose and what to believe. And, I mean, if you're listening to the show, at least you have the chance to hear the other options. Imagine the people that never know there's another option. Think about that. So the answer is it's a free country. You get to do pretty much what you want, and until Sarah Palin's death panels come up, and in a way they're coming up with these new insurances. The new insurances don't let you do everything you want to do. You can't even also sometimes even get CAT scans and MRIs to evaluate cancer patients. So they're already kind of telling us certain things that we can and cannot do. So it's hopefully we'll be able to have our choices, and each one can make their own opinion and decision and decide what's best. And that's all that I hope for, is to do the best I can for each patient one by one. That's all I can do. We have this radio show. We're trying to educate people about options. We're trying to bring data out, and hopefully people will understand the data and how I'm presenting it, so they're better, smarter consumers of healthcare.
Well, keep up the good work.
All right. Thank you, and God bless you. Gail, we missed you on the phone. You can call back if you want. 1-800-321-0710. 1-800-321-0710. I want to talk to you about a woman who came in with bladder cancer, a woman 70 years old, widow with one child, multiple medical problems. She's very obese. She had lung cancer treated years ago, thyroid disorder, lipid disorder, high blood, diabetes, heart disease, and now blood in the urine and bladder cancer. She went to her home hospital in New Jersey. They couldn't treat her. She went to a big, super big cancer hospital and saw a super big doctor, and they told her they can't treat her because, number one, they told her insurance. Number two, then they said, okay, I'll take her insurance, but they couldn't treat her because of her age and height and weight, and so she was sent home to die, 70 years old with localized bladder cancer. And then she heard about us. And she came in, and in one day, we were able to see her, examine her, fit her for stereotactic radiosurgery, stage her completely with a PET scan to see exactly where the cancer was, all in one day. More than has happened in the last 6 months to her. And she chose to be treated in 5 treatments, just like she heard about the 100-year-old woman who was successfully treated. And we're going ahead. And she's happy that people aren't sending her home to die at age 70. She thinks it's so unfair. And so do I, when they're not being told, even at the biggest cancer hospitals, that there are other options for bladder and other cancers. Another woman I talked to you about in the last month and a half, a woman with fallopian cancer. The fallopian tubes are the tubes between the ovary and the uterus where a little egg travels down every month. Woman developed fallopian tube cancer. In 6 years, she had 18 different chemotherapies, multiple surgeries, and the cancer never responded. It just kept on growing and growing. But it was growing, interestingly enough, in 2 separate areas of lymph nodes in the pelvis and abdomen. And when she came to us, the 2 areas merged to one, and we were able to treat both areas just in 5 treatments. This woman is 72 years old, but she works 3 days a week in a law firm in Manhattan. She's very spry, great personality, came through treatment, 5 treatments, no side effects, continues to work normally. No one knows anything about her treatment. She got her dose between April 7th and May 5th. She's got a date to return. We get a report card. The patient gets a report card, and that is a PET scan, a follow-up scan to show how the treatment worked. Because we think we shouldn't be operating blindly. The patient is entitled to know what's happened to my cancer. We're wanting to know what's happened. And so this way everyone knows. And I give a copy of the report to the patient and copies of the CD. So the patient actually has the images and knows exactly what's going on and can follow the cancer. And it's their right to have all the documents. And lastly, we had a gentleman, a 61-year-old black man with one daughter, divorced. He had pancreas cancer. He was being worked up a year ago elsewhere, and while the doctors were working him up, it took months to be worked up. The cancer traveled to the liver. Can you imagine that? It took so long to work him up, the cancer traveled to the liver. They're talking about doing a whippo or not doing a whippo or not whippo. And the cancer traveled. It went from localized to a stage 4 cancer. And then he had some chemo, and the chemo stopped working, and the surgeon and chemo people told him just that's it. And he's 61. If you saw this man, he'd look like any executive in Wall Street. Came to us. We repeated the cancer marker and actually found that the marker was down. We put together a regimen of systemic treatment and radiosurgery to treat the pancreas and the liver. Our ability to stop the pancreas cancer and in the liver is about 90%. So he's going through radiosurgery. He's very happy. There's people who are willing to give him a chance to put the cancer in remission. It's just about the end of the hour. Thank you for listening. If you have questions after the show, call us at 212-CHOICES. That's 212-246-4237. 212-246-4237. We'll send you a booklet DVD. Thank you for listening. God bless you. See you next week at 5 a.m. on WABC Saturday morning, and 4 shows next Sunday on WOR. Thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the